Hello, this is Dr. Daulton from Hammond Chiropractic, and in today's video I want to talk about the difference between physical therapy and chiropractic, because when most people say they're going to the physical therapist, or at least when they come into our office, it seems to me that they believe that each one is the same and that you can do one or you can do the other and get the same effect, and really it's completely the opposite. The two work hand in hand. They actually work very well together, but our goals are completely different. And actually, what my belief is that it's important that you do both chiropractic and physical therapy at the same time if you want to get the best result that's going to last the longest for you. All right? So let me just explain the difference here between the two for you so that you have an idea about what the best approach is for you to take for whatever condition is that you're trying to treat with either chiropractic or physical therapy or both. Now, the goal of chiropractic, or the main thing that we look at as chiropractors, is the alignment of your spine. Now, why do we do that? Well, let's take a look at my model here. And what you'll see here is that we've got two bones here stacked on top of each other. These would be bones that we'd be looking at in your spine. You have a disc, which is like a cushion between the two bones. And then at the back here, you'll see this opening that's created between the two vertebrae, or the two bones, where the nerves are exiting your spine. Now, these nerves are the most important thing because they control everything inside of your body. I kind of compare it to the electricity in a house. The electricity travels through these nerves out to all the organs and different parts of the body so that they can function at their very best. Okay, so it's kind of like turning the power on. Now, what chiropractors look for specifically is where these vertebrae in your spine have misaligned. So you can see in this example, I've pushed this bone back, and notice what happens. When I do that, it's going to close down on this opening where the nerve exits your spine, and it puts pressure on that nerve. And what that essentially does is it stops the power from flowing through that nerve out to the different parts of your body. So what chiropractors do is we find where these misalignments occur in your spine. We call these subluxations, and we actually do something called an adjustment, which gradually realigns the vertebra and brings it back to where it belongs, therefore taking the pressure off of the nervous system so that your body can function at its best. So not only is chiropractic about pain relief, because a lot of people think that we help with back pain and neck pain and headaches, which we do, but more importantly, it's about nervous system function and making sure that your nervous system is allowed to function at its best, because it's controlling the entire body, and therefore if your nerves are working good, the body's going to work at its best, okay? Now, what is physical therapy? What's the focus there? Well, the focus in physical therapy is to strengthen muscles and increase your muscle flexibility. That's the goal. So whereas a chiropractor's focus is on nervous system function, the physical therapist's focus is on muscle function. Now, why is that? Why do they focus on that? Well, the reason is because their theory, and actually it is true, that if you make an area stronger, if you strengthen the area that's damaged, then you're going to get it to heal a lot faster, and it's going to work a lot better than it did before. Now, let me explain how this is all put together, though, so that these concepts that we're talking about come together for you. You have to understand that your body, if you were to take it and split it right down the center, you would see that it's a mirror image, all right? So let me just make this little drawing for you here. So let's say we're looking at your spine, okay? You've got your skull up here, you have your tailbone at the bottom, and then here's the pelvis, all right? Well, we'll connect them together. So you got your legs, and then you got your shoulders and your arms up here. The way that this is all held together, and the way that we keep the spinal alignment the way that it's supposed to be, is by muscles. Muscles help us move. That's their function. That's their purpose. But if you look at it closer, what you're going to see is that you actually have these triangles of muscles that are created throughout the body. All right? And so if I look right down the center here, everything on this side is identical to everything on the opposite side. Can you see that from the picture here? And so what the goal is that we want these muscles working the same as we want these muscles working, because if they're pulling equally, it keeps everything nice and straight. Now, let me show you a little bit closer what is actually happening here. So if I just kind of look at this area of your low back, for example, and if I blow this up, let me draw a couple of vertebrae here for you, okay? Now, by the way, I'm not an artist, but I think you'll understand what I'm trying to say here if I just draw this out for you to the best of my ability. So here's how it looks if we look close up. So you've got your bones on top of each other. You've got the disc, which is the cushion in between the bones. Now, if we look at how the muscles are attaching here, what I'm going to see is that I've got muscles attaching here and muscles attaching here that are identical, and the same thing right below. And of course, it's a little bit more complicated than that, but basically this is how it works. So if these muscles are pulling evenly, you can see how that helps keep the spine nice and straight, and that's the goal. Now let's say you have a misalignment in your spine or a subluxation. Well, what's that going to look like? Well, it's going to look like this. Okay, so now we have this misalignment of the vertebrae, and of course that's an exaggeration, but what actually happens to the muscles when that occurs? Well, here's what happens. They start to adapt. So now all of a sudden, this muscle here is going to become shorter than this muscle here, because you see how that muscle is going to get pulled upwards? So these muscles are going to start to change their shape and their structure and the way that they work, all right? So let's think about this for a minute. If I go into physical therapy and I start to work on strengthening these muscles that are now unbalanced, what do you think is going to happen? Well, they're going to get stronger, correct? But guess what they're going to do? They're going to get stronger holding this vertebra out of its normal position. It's just like if you had a car whose tires were out of alignment, is the answer to correct that to run the car as fast as you possibly can? Is that going to fix the misalignment of the tires? No, you've got to get those tires realigned, and then you can drive as much as you want to and it'll be fine. But if you drive that car really fast with the tires out of alignment, it's just going to wear the tires out faster than they should wear out, and you're going to have to replace the tires more quickly. It doesn't make logical sense, right? So here's my thought on this. My thought process on this is everybody who goes into physical therapy for a spinal problem should also be seeing a chiropractor at the same time, and here's what should happen. The chiropractor should correct this misalignment so that we bring it closer to what this looks like here, and then the physical therapist should help you strengthen the muscles equally on both sides so that over time they start to hold the spine in this alignment here, which is going to make your spine a lot more stable, a lot stronger, and the results that you get from both are going to last a lot longer for you, okay? So I hope that explains what the difference is between physical therapy and chiropractic, and why it's so important that you actually utilize them together as opposed to utilizing just one of the two at the same time. It's a very, very powerful combination. They work well together. The chiropractor is an expert in spinal alignment and nervous system function. The physical therapist is an expert at muscles function and structure and making sure that they're re-strengthening the problem area so that it becomes more stable over time. Combine the two and you're going to get a much better result. Okay? All right, thank you so much for paying attention to me during this video. I hope it answered your questions and made common sense to you and that it helped you out. And of course, I'll see you on the next video. Thank you so much for watching.